Hello everyone. In today's video, we will be diving into the topic of headaches. Something almost everyone experiences at some point, right? Okay, what is headache? It is a pain or discomfort in the head, scalp or neck, and it is one of the most common medical complaints which can vary widely in intensity, location and duration. Headaches are often categorized based on their cause or characteristics, and they can fall into two main types. And I will focus on primary headaches, explaining their common types, causes, and how they differ from other headache categories. By the end, you will have a clear understanding of this everyday yet complex condition. Let's get started. Primary headache, which is most common and there is no underlying cause. And for the secondary headache, it is always associated with other disorders, most commonly the infections. Example, meningitis. Check out my video on meningitis. It's made simple and easy to understand. Okay, now let's get into the topic. Types of primary headache. There are mainly divided into three types. One is tension headache, which is the most common. Second one is migraine, and third one is cluster, which is most severe. Now let's dive into the topic of tension headache. The main reason for the cause of tension headache is stress, and the characteristic features are tight band-like, bilateral, and intermittent headache, which is waxing and waning type. And it is very important to know the value of these keywords because examiners are often favor certain keywords when crafting the exam questions. So we should identify and focus on those keywords to save time. And the treatment for the tension headache is taking rest and giving the paracetamol pill. Now let's check the topic of migraine headache. Just remember the rule of 5, 4, 3, 2, 1. 5, which means 5 or more attacks. That means recurrent condition. 4, the duration, which means 4 hours to 72 hours. And there is no rule of 3. I just added the 3 for the mnemonic to remember. And for the 2, at least 2 of the following should be there. The mnemonic is dump. D for disabling, which means moderate to severe intensity. U means mostly unilateral, which is 70%, and bilateral, which is 30%. M means movements, which increases the pain. And P means pulsative or throbbing quality. And this is the other keyword for migraine headache. And one means one of the associated findings like photophobia or phonophobia and nausea or vomiting. And these migraines are of two types, which is classical and non-classical. Classical means presence of aura, which means it gives the warning signs or symptoms before the attack. And non-classical is absence of aura, and it is the most common. And the treatment for the migraine is very important for the examiners to ask in our exams. And the treatment is giving rest, avoid triggers like photophobia, phonophobia, like that, and giving the NSAIDs. And if the migraine is very severe, then we can give the drug triptans as a drug of choice. And for the prophylaxis, we can give the first line drugs as beta blockers, next tricyclic antidepressants and topiramate, and the second line drugs as a valproate. Now let's check about cluster headache. For the cluster headache, the location is periorbital, that means ophthalmic division of trigeminal nerve, that is fifth nerve. And the duration of the cluster headache is 30 minutes to 3 hours, and it has multiple episodes for 5 to 8 days and mainly aggravate at night. And there are no triggers. And in addition to it, it has another feature also, that is activation of parasympathetic nervous system, which means it can increase in lacrimation, rhinorrhea and conjunctival congestion. And 20% of these patients have Horner syndrome. What is Horner syndrome? Let's check it. Horner syndrome, it causes due to the interaction of sympathetic nerve fibers. And here is the mnemonic for the Horner syndrome, and it is also an important topic for the FMGs and NEET PGs. And the mnemonic is electrical lamp. E means enophthalmos, that means sunken eyes. L means loss of ciliospinal reflex. A means anhidrosis, which means absence of sweat. M means miosis, that is contraction of the pupil, and P means ptosis, which is drooping of eyelids. And the treatment for the cluster headache is triptans and giving 100% O2 inhalation. Thank you for watching guys. Stay tuned for my next video where I will cover secondary headaches in detail. Don't forget to subscribe and hit the bell icon to stay updated. Also check out my video on meningitis, which makes the topic simple and easy to crack questions. Thank you.